Hello, I'm Dr. Theodore Whitman, sexual health physician and intimacy specialist, and welcome back to this channel where we break down the science of human sexuality so that you can make the most of your intimate life. Before we get into today's topic, if you haven't already subscribed, please take a moment to do that right now and activate the notification bell so you never miss our next video. Now, here's something I tell my patients regularly, and I want you to really sit with this idea for a moment. The quality of your sexual experiences is not just determined by what you do right, it is just as powerfully shaped by what you do wrong. Most people focus entirely on techniques, positions, or performance, but they overlook the fundamental mistakes they are already making that quietly sabotage their pleasure and their partner's pleasure every single time. So today I'm going to walk you through the 10 most common mistakes that lovers make in bed, mistakes that are backed by research in sexual medicine and psychology. And more importantly, I'm going to tell you exactly what to do instead. Let's start. Mistake number 1, skipping mental preparation and arriving at sex with a distracted, stressed mind. This is one of the most overlooked killers of sexual pleasure, and the science is absolutely clear on this. Brain imaging studies have shown that distraction and inattention directly impair our ability to attend to and process sexual cues. In other words, if your brain is elsewhere, your body cannot fully respond to pleasure. Researchers at the University of British Columbia and other leading institutions have demonstrated repeatedly that women and men who practice what scientists call sexual mindfulness, which simply means staying present and non-judgmental during intimacy, report significantly higher levels of sexual arousal, satisfaction, and orgasm frequency and intensity. When you arrive in bed carrying the stress of the day, mentally reviewing your to-do list, worrying about work deadlines, or feeling anxious about performance, your body literally produces higher levels of cortisol, the stress hormone, which redirects blood away from your genitals and towards survival muscles. Cortisol does not care that you are in bed with a partner you love. It is designed to shut down sexual function when the brain perceives threat or pressure. The correction here is simple but requires intention. Before intimacy, give yourself a transition window of at least 5 to 10 minutes. Put your phone in another room. Take a few slow, deliberate breaths. Let your body arrive in the room. Remind yourself that what is about to happen is something to be fully experienced, not mentally managed or performed. This single shift can transform the quality of everything that follows. Mistake number 2, neglecting personal hygiene or going to the other extreme and making too much of it. Now, I know some of you might think this one is too obvious to mention, but survey after survey in sexual health research shows that hygiene consistently appears in the top concerns that both men and women have about their partners during intimacy, which means it is not obvious enough. The basics matter more than people realize. Clean genitals, fresh breath, clean hands, and a body that does not carry strong, unpleasant odors are not romantic extras. They are genuine prerequisites to fully relaxed, uninhibited pleasure. Here's why this matters physiologically. When a person is distracted or put off by an unpleasant smell or sensation, the brain's threat detection systems are activated, which directly competes with and suppresses the arousal pathways. You cannot be fully aroused and fully repelled at the same time. The brain has to choose. That said, the correction here is not to over-sanitize or to use strongly scented products on the genitals, which can actually irritate delicate genital tissue and disrupt the natural pH balance that contributes to healthy sexual function and natural lubrication. A simple shower with mild, unscented soap on the external areas before intimacy is all that is typically needed. It is the difference between showing up for a beautiful meal and showing up for it. The gesture communicates care, and care creates safety, and safety enables pleasure. Mistake number 3, touching the genitals without adequate lubrication, especially early in the encounter. I see this constantly in my clinical practice, and it is responsible for far more discomfort and reduced sensation than people realize. The external genitalia, both the penis and the glands in men, and the vulva, clitoris, and labia in women are among the most densely innervated tissues in the human body. These are zones of extraordinary sensitivity. However, that very sensitivity means that when they are stimulated without sufficient lubrication, The friction becomes abrasive rather than pleasurable. What should be an experience of delicious sensation becomes an experience of irritation or even mild pain, and the nervous system will begin to associate that touch with discomfort rather than pleasure. For women in particular, natural lubrication is not a tap that opens on demand. It is a physiological response that requires both arousal and time. Many factors can slow or reduce natural lubrication, including hormonal fluctuations across the menstrual cycle, stress, certain medications including antihistamines, and some birth control methods, age, and simply not having had enough time to become sufficiently aroused. The practical guidance here is to approach the genitals gradually and gently, especially in the early stages of an encounter. Start with soft, light touch. Use saliva as an immediately available natural lubricant when needed, and do not hesitate to reach for a quality personal lubricant. Water-based or silicone-based lubricants are both excellent options, and using one should never feel like admitting some kind of failure. It is simply intelligent, attentive lovemaking. Mistake number 4. Abandoning kissing and oral stimulation of other body areas once the sexual encounter is underway. This is a fascinating mistake because most people do understand the importance of kissing at the beginning of intimacy, but research shows that many couples progressively reduce kissing as the encounter moves toward intercourse, treating it like a warm-up act rather than a continuous source of pleasure. This is a significant waste of one of the most powerful arousal tools available to you. The lips, tongue, neck, earlobes, inner wrists, and the entire surface of the skin are rich in what scientists call mechanoreceptors and thermoreceptors, which are neurological sensors that, when stimulated with warmth, pressure, and movement, send excitatory signals directly to the brain's pleasure and reward centers. Kissing in particular triggers the release of oxytocin, dopamine, and serotonin simultaneously, creating a neurochemical cocktail that amplifies feelings of connection, desire, and physical pleasure. Beyond the neurochemistry, kissing and physical contact across the whole body deepens the sense of intimate connection with your partner, and emotional closeness is not separate from physical pleasure. For most people, and especially for women, research consistently shows that emotional safety and connection are fundamental drivers of arousal and orgasm. The practical correction here is to treat kissing and tactile stimulation of the full body not as a phase you go through before the real thing, but as an ongoing dimension of the entire experience from beginning to end. Mistake number 5. Following a fixed script or routine, meaning doing the same things in the same order every time. I understand why this happens. You find something that works, something your partner responded well to, and naturally you want to repeat it. But let me explain why this is actually working against you. From a neurological standpoint, the brain's reward and arousal systems respond strongly to novelty. When experiences become predictable and routine, the dopamine response, which is the neurotransmitter most directly associated with desire and anticipation, begins to diminish. You are essentially training your nervous system to become bored with something that should feel exciting. Research in sexual psychology has consistently shown that sexual boredom and routine are among the top reasons both men and women report declining interest in sex within long-term relationships. Beyond the neurochemistry, every person's desires, preferences, and needs vary not only from partner to partner, but from day to day and week to week, depending on their emotional state, stress levels, hormonal cycle, and general mood. Arriving at intimacy with a fixed program means you are not actually responding to the real person in front of you today. You are responding to a template. The correction involves bringing genuine curiosity and adaptability to your intimate encounters. Think of each experience as a conversation, not a performance. Pay attention to what your partner is responding to in the moment, not just what they responded to last time. Be willing to slow down, change direction, try something different. Spontaneity, creativity, and the willingness to explore are not just nice additions to a sex life. They are the engine that keeps desire and pleasure alive over time. Mistake number 6, using language or communication styles that are mismatched to your partner's current state. Communication during intimacy is powerful, but only when it is calibrated to what your partner actually needs in that moment. Some people respond beautifully to passionate, intensely expressive language during sex. Others find the same words jarring or uncomfortable. Some moments call for tenderness and soft emotional connection. Other moments call for directness and raw expression. The mistake is not communicating at all or communicating without reading the room. Clinical research in sexual medicine has shown that partners who can clearly communicate their desires, boundaries, and experiences during intimacy report significantly higher satisfaction and are far more likely to experience orgasm. But communication has to be attuned. If your partner is in a deeply emotionally connected, tender state, and you suddenly switch to harsh or crude language, you are likely to break the spell entirely. Conversely, if your partner is highly aroused and seeking an intense experience, overly clinical or timid language may feel deflating. The correction here is to pay attention before you speak. Read your partner's energy, their breathing, their body language, their facial expressions. These are all forms of communication that tell you what register to meet them in. And if you are genuinely unsure, a simple, warm, real question asked in the moment, a question like, "Does this feel good?" or "What do you want right now?" is never a mood breaker. In fact, that kind of attentive checking in is something most partners find deeply reassuring and often even more arousing. Mistake number 7, withholding honest feedback, or worse, providing false feedback. This is a mistake that feels kind in the short term, but causes real harm over time. I hear this frequently in my consultations. One partner has been tolerating something they don't enjoy, or has been faking pleasure they don't feel, because they didn't want to hurt the other person's feelings or disrupt the moment. I understand the impulse, it comes from a generous place, but the consequences are significant. First, when you withhold honest feedback, your partner genuinely believes they are giving you pleasure and continues doing whatever they are doing. They do not know to try something different because you have told them, verbally or non-verbally, that everything is fine. Over time, patterns become established that are difficult to reverse. If you have been pretending to enjoy something for 2 years, it becomes enormously harder to suddenly say you never actually liked it. The longer feedback is withheld, the more awkward the eventual correction becomes. Second, from the perspective of your own experience, tolerating discomfort or performing pleasure you don't feel keeps you in a mentally disconnected state during sex, which research has clearly linked to reduced arousal, reduced satisfaction, and lower overall sexual well-being. Honest feedback does not need to be delivered critically or harshly. There's a significant difference between saying, "I don't like that," and saying, "I love it when you do this instead." Frame your feedback in terms of what you enjoy and want more of. Lead with pleasure, not complaint. This kind of generous, honest sharing is one of the greatest gifts you can offer a partner. Mistake number 8, not receiving your partner's feedback or signals, particularly signals of discomfort or withdrawal. This is the mirror of the previous point, and it is arguably the most important mistake on this entire list. The ability to read, hear, and genuinely respond to your partner's feedback, whether that feedback is verbal or communicated through body language, is the foundation of ethical, satisfying intimacy for both people. Research in sexual health and psychology consistently shows that one of the most significant factors in sexual dissatisfaction, particularly among women, is the experience of having their cues of discomfort, hesitation, or withdrawal ignored or overridden. When someone slows down, tenses up, becomes quiet, looks away, or says no in any form, that is not ambiguous information. That is a clear signal asking for a pause, a check-in, or a stop. Some people rationalize continuing past these signals with the belief that their partner will eventually warm up or that persistence will lead to enthusiasm. This thinking is not only harmful to your partner, it is harmful to the relationship itself. Trust, the fundamental ingredient of genuine sexual intimacy, is built through consistent demonstrations that you are listening, that you are paying attention, that what matters to your partner matters to you. The practical guidance here is this: when in doubt, pause and ask. Slowing down to check in has never ruined a genuine sexual connection. A soft, caring question in the middle of intimacy shows your partner that you are there with them, not just pursuing your own experience. And that kind of attentiveness is profoundly bonding and deeply attractive. Mistake number 9, treating intercourse or penetration as the primary or only meaningful form of sexual activity. This is one of the most persistent and research-refuted myths in sexual culture, and yet it continues to shape how enormous numbers of people approach intimacy. Multiple large-scale studies of sexual satisfaction in both heterosexual and same-sex couples have found that the duration and quality of what researchers call non-penetrative sexual activity, meaning whole-body touch, manual stimulation, oral intimacy, prolonged arousal, and focused attention to erogenous zones across the entire body, is a far stronger predictor of satisfaction than penetration duration alone. In studies involving women in particular, the majority report that penetration without adequate prior arousal and whole-body engagement is rarely sufficient for full sexual satisfaction. The anatomy of the clitoris, which extends internally and has significantly more neural connectivity than was recognized even 20 years ago, is primarily engaged not through penetration but through external and contextual stimulation that requires time and responsiveness. For men, the assumption that performance during penetration is the measure of sexual quality creates performance pressure that has been clinically linked to anxiety, reduced erection quality, and premature ejaculation. When the entire pressure of a sexual encounter is loaded onto one act, both partners lose. The correction is to genuinely expand your definition of what sex is. Think of penetration when it occurs as one element within a much richer experience, not the destination toward which everything else is merely pointing. Aim to spend at least 2/3 of your total intimate time in forms of connection and pleasure that have nothing to do with penetration. Your body will thank you. Your partner will thank you. Your sexual satisfaction statistics will improve dramatically. Mistake number 10, neglecting the period immediately after sex, what researchers actually call the post-sex affiliation window. This final mistake is one that many people have never even considered because popular culture tends to treat sex as an activity with a clear ending point. But in sexual medicine, what happens in the minutes and hours immediately following intimacy matters enormously, both for the quality of that particular experience in the memory and for the long-term health of the sexual and emotional relationship. Here is the science. During and after orgasm, the brain releases a surge of oxytocin, sometimes called the bonding hormone, along with endorphins and other neurochemicals that create feelings of warmth, safety, and closeness. This post-sex window is neurochemically optimized for deep connection, emotional intimacy, and the reinforcement of positive feelings toward your partner. When one partner immediately reaches for their phone, turns on the television, leaves the room without acknowledgement, or simply falls asleep without any transition gesture toward their partner, the other person often experiences what researchers describe as a sudden emotional withdrawal. The neurochemical warmth of the encounter is abruptly replaced by a sense of abandonment, disconnection, or insignificance. Over time, these patterns erode the emotional safety that underlies genuine sexual desire. People begin to protect themselves from that post-sex drop by becoming less emotionally invested in the encounter to begin with. The simple, evidence-backed correction is to remain present for at least 10 to 15 minutes after intimacy ends. Stay close. Keep physical contact. Speak warmly. Share something honest. Let the transition out of the experience be gentle and connected rather than abrupt. Think of the sexual encounter not as ending with the last moment of physical activity, but as extending into a short, tender window of shared presence afterward. Couples who consistently manage this post-sex transition well report significantly higher overall relationship satisfaction and, importantly, significantly higher desire for future intimacy together. And there you have it, the 10 most impactful mistakes that lovers make in bed, all of them correctable, all of them backed by the latest research in sexual medicine and psychology. Let me leave you with the central idea that ties all of these together. The quality of sexual intimacy is not primarily a physical skill. It is an attentional and relational practice. It requires you to be present, to be curious, to listen, to communicate honestly, and to treat your partner's experience as genuinely as important as your own. When you do those things consistently, almost everything else takes care of itself. Thank you for watching all the way to the end of this video. If you found it valuable, please leave a comment below and let me know which of these 10 mistakes you have encountered most often. Do not forget to subscribe and activate the notification bell so you are the first to see our next video. I have much more to share with you, and I will see you very soon.